Hello my friends and welcome back to the channel. I'm so glad to see you today. Let me ask you this, have you ever noticed that right in your yard, garden, backyard, or even along the roadside, wild plants are growing that most people see as useless weeds? But here's the secret. Some of these plants are actually powerful natural medicines that can lower blood sugar, stabilize blood pressure, and even help prevent diabetes, sometimes just as effectively as expensive drugs. One of the most amazing of them is the ground cherry, also known as physalis. It has green stems, pointed leaves, and small round fruits covered by a thin husk that looks like a little lantern. Most people ignore it, but in traditional medicine, this plant is seen as a true treasure for those dealing with high blood sugar and hypertension. You can eat the young leaves and shoots by boiling, stir-frying, or making soup. But the most effective way is to harvest the whole plant, wash it, cut it into small pieces, dry it, and brew it into tea. If you follow a simple cycle, drink for 10 days, rest for 7 days, then repeat, it can help balance blood sugar, support healthy blood pressure, and in mild cases of diabetes, even bring levels back toward normal. But ground cherry is not the only natural helper. There are many other powerful plants around us. Mango leaves dried and brewed into tea, they support the pancreas and naturally reduce blood sugar. Guava leaves rich in tannins, they help block sugar absorption from food and stabilize blood sugar after meals. Bitter melon, a well-known vegetable containing charantin, scientifically proven to lower blood sugar. Bitter herbs such as gymnema or bitter leaf, often called the sugar destroyer, they reduce sugar cravings and support glucose control. Turmeric, ginger, and garlic, common kitchen spices, but powerful natural medicines that improve circulation, lower cholesterol, and prevent diabetes complications. All of these herbs can be used in a simple way. Harvest them, wash, cut into pieces, dry, and brew as tea. According to Eastern medicine, you should drink it 3 times a day: morning, noon, and afternoon. If your stomach is strong, drink it 30 minutes before meals for the best absorption. If your stomach is weak, drink it after meals. Always follow the cycle. 10 days on, 7 days off, then repeat. This steady habit helps your body stay balanced, keeps blood sugar and blood pressure under control, and protects against diabetes complications. My friends, remember this: good health doesn't always come from expensive medicines. Often it's hidden in the simple plants growing right outside your door. With the right knowledge and consistency, your body can heal and stay strong naturally. I truly wish you and your family great health and happiness. And don't forget, if you found this video helpful, please support the channel by subscribing and turning on notifications so you don't miss our next health videos. Thank you for watching, and see you in the next one. Are you concerned about diabetes and its potential symptoms? In this video, we'll explore the top 8 most common symptoms of diabetes. It is essential to be aware of these signs, as they indicate that your body's blood sugar levels are too high, which can lead to serious complications if left untreated. But don't worry, we've got you covered. By watching this video, you'll learn how to identify diabetes early through common symptoms, so you can take quick action to manage it effectively and prevent further health issues. So let's dive right in and discover the alarming signs of diabetes. Number 1. Constant thirst. The first symptom is constant thirst. When there's too much sugar in your blood, your kidneys work overtime to filter and absorb it. However, when they can't keep up, the excess sugar is expelled through urine, taking fluids from your tissues with it. This process leaves you dehydrated, triggering a sensation of thirst. So even after drinking plenty of water, you might still feel thirsty. This excessive thirst is medically known as polydipsia and is one of the primary indicators of diabetes. Therefore, if you find yourself constantly thirsty despite frequent water intake, it could be a sign of diabetes. Number 2. Frequent urination. Frequent urination, especially waking up at night to use the restroom, is another telltale sign of diabetes. As mentioned earlier, when your body expels excess sugar through urine, it also flushes out additional fluids, leading to increased urination. On average, people with diabetes may urinate about 3 to 4 liters more per day than usual. This frequent need to urinate can disrupt your sleep and daily routine, and being thirsty all the time can become a real nuisance. If you notice that you're making more frequent trips to the bathroom than usual, particularly during the night, it's essential to consult your healthcare provider. While increased urination alone doesn't necessarily diagnose diabetes, it's crucial to rule out other potential causes. Number 3. Always feeling tired or drained of energy. If you're always feeling tired or drained of energy despite getting enough sleep, it could be an indication of diabetes. When your body isn't functioning efficiently due to elevated blood sugar levels, it can leave you feeling fatigued. Cells rely on glucose for energy, but insulin helps regulate blood sugar levels so that cells can absorb glucose effectively. However, if you have diabetes, insulin might not be working properly, leading to glucose buildup. in your bloodstream instead of being used by your cells. This results in your body not being able to produce enough energy, leaving you persistently tired. Additionally, another reason for constant fatigue in diabetes patients is that high blood sugar levels can cause dehydration due to frequent urination, which further contributes to feelings of tiredness. Number 4. Unexplained weight loss. Another common symptom of diabetes is unexplained weight loss, when your body cannot properly process carbohydrates into energy due to insulin resistance or insulin deficiency. It starts breaking down muscle and fat for fuel. This process leads to a decrease in body weight. However, it's important to note that weight loss is not a direct result of diabetes itself, but rather a consequence of the body's response to elevated blood sugar levels. It's possible to experience significant weight loss even without actively trying to diet. If you've noticed unexplained weight loss coupled with other diabetes-related symptoms like increased thirst or frequent urination, it's essential to seek medical advice promptly. Consulting your healthcare provider can help determine if there are underlying issues contributing to the weight loss and guide you toward appropriate management strategies. Number 5. Slow healing wounds and frequent infections. Slow healing wounds and frequent infections are concerning symptoms that can indicate diabetes elevated. Blood sugar levels can impair your body's immune system and circulation, making it harder for wounds to heal. A compromised immune system means that your body might not fight off infections as effectively. Moreover, high blood sugar levels can damage nerves and blood vessels, affecting the delivery of nutrients and oxygen to your skin. This can lead to a higher risk of developing skin infections. In fact, studies have shown that individuals with diabetes have a significantly higher risk of developing skin infections compared to those without diabetes. So if you notice slow healing wounds, frequent infections, or any unusual changes in your skin, it's crucial to consult a healthcare professional. These signs could indicate underlying health issues related to diabetes that require attention to prevent further complications. Number 6. Blurred vision. Blurred vision is another common symptom of diabetes. High blood sugar levels can affect the eyes, specifically the lens's ability to focus. When there's too much sugar in your blood, your eyes may begin to swell, causing the lens to change shape and affecting your vision. Furthermore, prolonged periods of high blood sugar levels can damage the tiny blood vessels in your eyes, leading to conditions like diabetic retinopathy. Over time, this can result in more severe vision problems. If you've noticed any changes in your vision, it's important to consult an eye specialist immediately. Early intervention and proper management of blood sugar levels can help prevent further complications and preserve your eyesight. Number 7. Dry, itchy skin. Dry, itchy skin is a symptom that can occur due to diabetes. High blood sugar levels can lead to dehydration because your body tries to compensate by urinating more frequently. This can result in dry skin and itching. Additionally, diabetes can impair your body's circulation, reducing the flow of fluids and nutrients to your skin. Consequently, your skin might become dry and itchy due to lack of proper nourishment. Moreover, elevated blood sugar levels can weaken your immune system, making you more susceptible to skin infections that can also cause itching. To manage dry, itchy skin associated with diabetes, it's crucial to maintain good hydration by drinking plenty of water. You should also try to keep your skin moisturized by using a gentle, fragrance-free lotion. And if you notice any signs of infection, such as redness or swelling, consult your healthcare provider promptly. For men, erectile dysfunction. For women, frequent yeast infections. Erectile dysfunction in men and frequent yeast infections in women are sexual health issues that can sometimes be linked to diabetes. Diabetes can increase the risk of both of these conditions. In men, high blood sugar levels can damage nerves and blood vessels, including those responsible for erections. This can lead to erectile dysfunction or difficulty achieving or maintaining an erection firm enough for sexual intercourse. Similarly, in women, elevated blood sugar levels can make them more susceptible to yeast infections. Yeast infections occur when there's an overgrowth of a fungus called Candida. High blood sugar levels can create an environment that's more favorable for this fungus to grow, increasing the likelihood of infection. If you notice 2 or more of these signs, it's a good idea to get your blood sugar tested early. Early detection and management of diabetes are crucial to prevent potential complications and ensure better overall health. Now that you know the common symptoms of diabetes, let's move on to the next topic, which is a 7-day meal plan for people with diabetes. A well-balanced diet plays a vital role in managing diabetes. It can help control blood sugar levels, prevent complications, and improve your overall health. That's why we've created a 7-day meal plan specifically designed for people with diabetes. This meal plan emphasizes consuming whole, unprocessed foods such as fruits, vegetables, lean proteins, and whole grains while limiting refined carbohydrates and sugary foods. It also encourages frequent, smaller meals to help maintain stable blood sugar levels throughout the day. General rules: avoid refined carbs and sugary foods. Choose whole grains, green vegetables, low-sugar fruits, fish and lean meats. Drink plenty of water, avoid soda and alcohol. Eat smaller meals more often, 3 main meals plus 2 snacks daily. Let's start with day 1. Breakfast, oatmeal plus 1 boiled egg. Lunch, grilled chicken breast plus green salad plus 1 slice of whole wheat bread. Dinner, steamed fish plus boiled vegetables. Snacks, 1 green apple, a handful of almonds. Day 2, breakfast, whole grain bread plus low-fat cheese. Lunch, lean beef stir-fried with broccoli. Dinner, shrimp pumpkin soup plus boiled greens. Snacks, sliced cucumber and carrots. Day 3, breakfast, brown rice porridge with vegetables. Lunch, grilled salmon plus asparagus. Dinner, soft tofu in tomato sauce plus bok choy. Snacks, 1 small pear, a few walnuts. Day 4. Breakfast, sugar-free whole grain cereal plus unsweetened soy or almond milk. Lunch, chicken stew with mushrooms. Dinner, braised mackerel plus steamed vegetables. Snacks, 1 small grapefruit. Day 5, breakfast, fried eggs plus lightly. Vegetables. Lunch, tuna salad with purple cabbage. Dinner, vegetable soup plus lean ground meat. Snacks, fresh blueberries, a handful of almonds. Day 6, breakfast, brown rice and mung bean porridge. Lunch, steamed chicken breast with ginger plus boiled vegetables. Dinner, sour soup with basa fish plus water spinach. Snacks, 1 kiwi, a few cashews. Day 7. Breakfast, oatmeal with unsweetened yogurt plus chia seeds. Lunch, lean pork braised with white radish. Dinner, steamed fish with ginger and scallions plus boiled greens. Snacks, 1 small orange, roasted pumpkin seeds. Following this 7-day meal plan can help people with diabetes stabilize blood sugar, support weight control, protect the heart and reduce the risk of complications. Remember, it is essential to consult with a healthcare professional or a registered dietitian before making any significant dietary changes, especially if you have diabetes or other health conditions. They can provide personalized guidance based on your individual needs and help you create a meal plan that works best for you. Take care and stay healthy.